Today we are going to be treating my lovely patient. She is a real housewife of San Diego, and she's here today to get help with facial rejuvenation, to get a fresher look. And we are going to be doing that today with the Potenza device by Cynosure Lasers. And this is a device that is microneedling with radio frequency. Now, how is this different from other devices that are on the market? Well, this one will actually let me deliver radio frequency at different levels of the tissue. So I can cause tissue coagulation at different levels, which will then cause tissue rejuvenation, healing, and then helping smooth those fine lines and wrinkles while it does that. The other thing that is fantastic about radio frequency with this particular device is that I can also treat skin of different color. So if you have a darker skin color, this particular device is safe because I can adjust the different parameters, and I will then be able to protect those delicate melanocytes that are the pigment producing cells. And as I go along, I'm making sure that I am having a 25% overlap. Now, if I was just giving one pass to the entire face, I would not be doing necessarily the overlap, but you certainly can. If you're doing two passes, you probably want to consider maybe not doing the overlap. Going after the forehead wrinkles, which are prominent in a lot of people. Your forehead gives you a lot of expression, and the more that you're using your forehead, the more you're going to be developing wrinkles that occur over time. So I usually recommend also consider doing Botox. Botox is a neuromodulator that can help kind of reduce the formation of those wrinkles. Neuromodulator is considered more something of a preventative, while something like this Potenza is more reactive. Both good, both recommended. Okay. So now I have done one pass on her face. So I'm going to go back at lower settings and do another pass on the cheeks and the forehead. When you're treating the nose, you're usually treating larger pore sizes because the nose tends to have larger pores, maybe bigger sebaceous glands, all normal. But people really like to have their pores made a little bit smaller. I'm just going right along the orbital bone. I'm not going really any higher than that. Sometimes too, what you can do if the person's used numbing cream, you can actually kind of pull up and you can treat the skin right underneath the eye. My patient's pretty young and doesn't really have much of an issue with that, so we didn't have her put the numbing cream there. But otherwise, you can do that. And then usually as far as the redness goes, from what I've seen, it usually lasts anywhere from about 6 to 24 hours. So I wouldn't necessarily say this is something you go right back to the office without somebody knowing what you've had done. But it's not going to give you that really prolonged downtime of some of the other devices that are on the market. All right, so how do you feel?
I feel fine. I feel like a little bit of tingle, and my skin's a little bit tingly, but it really wasn't painful.
Okay.
Yeah.
Good.
That's great.
All right. So at the very end, what I usually have my patients do, I will give this lovely patient a little bit of hyaluronic acid. There's a particular brand that I really like, which you can find on my blog and also on my Instagram site. But it's a hyaluronic acid that is, it produces water within the skin, so it allows the skin to kind of plump a little bit. And it's a very good component to go after this procedure. Patients tell me that they feel a little bit like they have a little bit of a sunburn, but as soon as they put their hyaluronic acid on afterwards, and it makes it feel 100% better within just 2 or 3 minutes. Okay, so if you have interest in doing this, I highly recommend it. Again, great for fine lines, wrinkles, treatment of large pores, and then also for scars as well too.